पॉलिसी बाजार पर 1 करोड़ रुपए का टर्म लाइफ इंश्योरेंस केवल 450 रुपए महीने से शुरू। Wow.
Joining us right now on the panel, Jasmine Shah, spokesperson of Aam Aadmi Party, Alok Vats, BJP leader, as well as Dr. Shailesh Jain, who is an ICMR scholar. Well, first, let me go over to Jasmine Shah. Thank you for joining us, Jasmine Shah. But you saw the reality check done by NDTV across hospitals. My first question to you, at a time when Delhi has just about 24% of a population that has got a booster dose, the health ministry says January is going to be very crucial for the COVID situation in India. There seems to be absolute shortage of vaccines in Delhi.
First, let me congratulate NDTV for bringing this matter to the light. As Delhi government, let me say that there is no need to alarm for the people of Delhi. The situation of COVID is quite under control. Every day, only around 15 to 16 cases are being reported. At the same time, Delhi government has geared up every single aspect of COVID management, be it hospital beds, 36,000 hospital beds. We're talking about having the right, equipment, ventilators, oxygen cylinders, concentrators. All of that, mock drills are happening. PSA oxygen plants are geared up. On the front of vaccination, we must understand that the supply of vaccine is completely regulated by the central government. Delhi government, like all other state governments, can only requisition the central government for additional doses, and it's the central government that distributes. What we have learned is that for the last 4 to 5 days, there has been a shortage of vaccines in Delhi. Delhi government has consistently demanded more vaccines. And we have now been assured that in a day or two, which is latest by 1st of January, the additional vaccine stocks will connect with Delhi. But we've also learned that across the country, as on date, there are less than 1 crore vaccine stocks that are available with the central government. And it is not just Delhi that is affected. Karnataka government has raised a request with the central government. They have not received vaccines. Gujarat has requested, UP has requested, Rajasthan has requested, but consistently for the last week or so, I'm not sure what kind of planning at the central government level has happened. Right. I only pray and hope that the kind of mess that we saw in the oxygen supply, again, during the peak of the Delta wave, we knew that oxygen supply was regulated by the center. Center allocates stocks and make sure that state governments have it. We saw that was quite
Jasmine, let me get Mr. Alok Vats here to respond to what you have been saying. Mr. Alok Vats, my colleague Priyanshi wants to ask you a question, but before that, do you want to respond quickly to what the allegations that Jasmine Shah seems to be making here, that even the centre has just about 1 crore vaccines and multiple states have been seeking requests? Priyanshi, do you want to add a question?
Sneha, I was just wondering that usually we see that fight between the Delhi government and the central government. But if I can ask Mr. Jasmine Shah this question, that now the state governments can also buy 25% of stock. So if they are allowed to buy that, why is there no stock at even Delhi government hospitals? I think it's time that we stop the blame game and actually get to the work.
Right. We'll get Mr. Jasmine to respond to that. Mr. Jasmine, we'll just come to that. But first, let Mr. Alok Vats respond.
Sneha and Priyanshi, let me tell you one thing. Let's not, and I will request Jasmine also not to politicize it. Let's not play politics in everything. Here it's matter of life and death. See, suddenly because of the COVID fear, of late people had thought that COVID from India has gone.
True, and people were across the world. Correct.
And people, especially in India, people were very casual. I could hardly see anybody wearing masks or using sanitizers. Even, so to say, even I had stopped using it. It
all
was lying in... Let's be frank and admit the fact. But now, since the fear has come all of a sudden, so there is a demand. People who had not taken the doses, they have also lined up. And you see, these medicines have to be kept at a particular temperature. And I think every hospital has a capacity, and they cannot store more than that. But as the manufacturers have said, even Punewala is on the record saying that there is no dearth of medicine. So maybe it will take a few days. So after the first, the flow will be normal, and we should not panic on this. Yes, at present, I have also done my survey that in many centers the stock has gone out. It has gone out of stock because
Right.
of the sudden surge of people. एकाएक भीड़ बढ़ गई है सारे सेंटर्स पे. So that stock has finished.
Get
but
your
there's
point,
nothing to
Mr.
panic.
Alok. Well, we also have Dr. Shailesh Jain along with us. Dr. Shailesh Jain, you heard the discussion briefly. You heard Mr. Jasmine Shah as well as Mr. Alok Watts and my colleague Priyanshi. Now, tell us this. Beyond the politics, as cases are surging globally, if vaccines are not available currently in the national capital, is it worrisome or is it over the bush?
It is definitely a worrisome. And I request to all the color of the party that don't make the citizen of country as a scapegoat. Because I personally feel that COVID is a really life-threatening disease, and this is the duty of the central and the state government to provide the vaccine free of cost to every citizen of the country. In fact, in your show only, I said earlier that vaccine which has been given in the private hospital at the cost of 1,500 rupees and 800 rupees, that is not justifiable at my point of view. Because if you can provide the free food grain to whole country, why not the free vaccine to the whole country? And this is a real truth that today only we have around 3 or 4 vials of the Covaxin in Delhi government center. Vaccine is not available. Now you have to ensure and you have to take the responsibility. This is the mistake of whom? It is the mistake of the central government or it is the mistake of the state government. But don't make the citizen suffer because of your politics. The vaccine has to be provided for the citizenship, and once we are telling it that vaccine in the next 20 or 30 days, the disease has to come in our country, then we have to make responsible that sufficient stock should be available. And second thing, I am not able to understand why the stock is available in the private hospital and not available in the government hospital. If it is not available in the government hospital, why you are not taking it from the private hospital? You can take it on the loan, and once you will get the stock, you will return to the private hospital. But you should not allow the poor people to go to the private hospital and get the vaccination done at the private hospital at the cost of 800 rupees.
Right. Thank you very much, Mr. Shailesh. We're totally out of time, but 30 seconds to Jasmine Shah and Alok Watts' last comments on where should people go in the next few days. Around 14% of Delhi is below poverty line, considerable population over 60. Where should they go in the next few days at a time when vaccines are almost not available, free vaccines very, very scarce across Delhi? 30 seconds, Jasmine Shah and Alok Watts.
See, I'll complete my last statement as well, which is that there is an existing system in Delhi, which is that Delhi government requisitions vaccines from the central government and central government sends it. I think time has come that central government can indicate if it is going to provide vaccines or not, because if not, Delhi government will go buy it. There's some kind of a miscommunication or misplanning as it seems. But the last communication we received that we'll receive the additional stock in 1 or 2 days. And I assure the people of Delhi that Delhi government is on the top of this. We are tracking the progress with the central government. And as soon as we get an indication, we will put out the message for the people of Delhi to come avail of free vaccines.
Mr. Alok Watts.
Sneha, there is no need to panic. The Delhi government should purchase their quota, and we assure you that within 2 or 3 days, we will replenish all across the hospitals the required doses. There is no doubt of it. I have just confirmed with the people, things are on the way, and it will be plenty of stock, so there is no need to panic. Yes, for a couple of days, one should hold their breath till the stocks arrive. And I think in New Year, there will be no shortage of any kind. We have sufficient stocks and we have sufficient production going on.
Thank you, Jasmine Shah and Alok Watts. But sadly, the irony is, during the Christmas season and the New Year festivities, when perhaps the booster doses should have been given out the most, is when there's a scarcity. And as is being reported not only in Delhi, but in several parts of India as well.